Today, I'm going to talk to you about 5 things you need to know for getting back to running postpartum. Number 1 is coordination. The first step to get back to running postpartum is restoring your core and breath training. This means you should be focusing on coordinating your abdominals, pelvic floor muscles, and your breathing. Posture is also an important part of this first step because you have suddenly gone from a pregnant body to carrying around a growing baby while your tissues are still healing, and posture can really impact your function. I think coordination is the hardest part because it takes a lot of concentration. You're essentially working on your brain's ability to communicate back and forth effectively to your muscles. And it can be really challenging to engage your abdominal muscles, your pelvic floor muscles, and your glutes postpartum. So focused practice is the most important place to start and is the foundation of your movement. I'm Emily Bliss, physical therapist, running coach, and mom of 3. I'm the founder of Moms on the Run, where I help moms get back to running postpartum. Okay, number 2, basic strength training and getting back into exercising. Once you have your coordination down, you can start gentle strength training of all your muscle groups and gentle cardio. I usually recommend people start with gentle floor exercises to strengthen glutes, abdominals, adductors, pelvic floor muscles if needed, because it's a gravity minimized position and a safe place to start within the first 6 weeks. I also recommend adding exercises like squats and lunges into early postpartum exercising because it's already something you're going to be doing every day as a parent, and you might as well strengthen the movements that have the highest demand on your body. From here, you can add more challenging exercises as you get stronger over the next few weeks. Single leg control is really important for running, as is moving through different planes of motion. But walking comes before running, and getting out for regular walks postpartum not only helps with your mental health, but gets your body ready for some of the demands of running. I recommend to my patients and clients to be able to walk about 30 to 60 minutes a few times a week before they are ready to start a return to running protocol. Okay, number 3 is the return to impact testing. How do we know when your body is ready to run? I've created a protocol based on the guidelines published in 2019 by Tom Goom, Grenia Donnelly, and Emma Brockwell. There's a series of tests including a standing pelvic floor test, leg strength test, and impact tests. Running is a high impact sport, so we break down the movements of running into a series of exercises that use the same muscles and require similar strength and tolerance to impact as running. When you can perform everything on the protocol, you're probably safe to start your return to run program. I actually use the modified version of the exercises from the protocol as part of the home exercise programs for my patients and my clients. Then I progress them to the harder versions of each exercise until they can do the full protocol and are ready for a return to run. Okay, number 4 is returning to run. This is the fun part, but it's also important to be smart. Make sure you've been cleared by to exercise by your OB provider first. Research tells us it's not recommended to start running before 12 weeks postpartum. There are certainly exceptions to this, and there are also plenty of people who don't feel comfortable attempting to run within the first year postpartum, and that's okay. Having spent the last decade treating running injuries, I can tell you firsthand that getting back to running too soon and skipping the foundational work leads to injuries down the road. Okay, so I created a simple return to run protocol. It's based on my favorite post-injury return to run protocol by the Running Clinic out of Canada. But I modified it for the busy mom with time constraints. It's a basic walk-run protocol where you alternate bouts of walking and running, and add more running every time you go out. If you feel great, you can skip ahead a workout. If you need to go back a workout, you can do that as well. If you can be patient for the first 4 to 5 weeks, then the last 3 to 4 weeks will feel great, and you'll be running 30 minutes without any walking by the end of the protocol. Patience is the most important part here. I've seen it work with elite athletes. I've used it 3 times as a mom of 3 returning to run postpartum. Okay, number 5, know your red flags. It's really important to know when to back off or when to seek medical guidance when you're returning to run postpartum. Let's talk about what to pay attention to. But first, no tissue healing time. The first few days postpartum is the inflammation phase. Depending on the type of birth, whether it's vaginal delivery or a C-section, you might notice things are bloody, scabbed over, red, swollen. This is a time when you want to protect those areas. Then your body enters the proliferation phase, where it spends 1 to 4 weeks creating new tissues. Essentially, this is the repairing part, and the new tissue is delicate. So you don't want to overload the affected area, and the amount of time this takes depends on how damaged your tissues are. Did you have an emergency C-section or a grade 1 tear from a vaginal birth? The last phase is remodeling, which is when your body converts the new, more delicate tissue to new, more mature tissue. This can last 3 weeks to months and up to 2 years. So this is why everyone's experience can be different, and it's important not to compare yourself to others. So basically, you're looking at somewhere between 6 to 8 weeks of normal tissue healing, hence your 6-week follow-up with your OB provider. They need to make sure things are healing properly before clearing you to get back to exercise. Now, let's talk about red flags. Number 1, increased bleeding is probably the biggest one postpartum if you do too much too soon. And it's advisable to talk to or see your OB provider if you notice an increase in blood loss. Urinary or fecal incontinence, which is the loss of bladder or bowel, is considered a red flag. It's not an emergency, but it's your body's way of telling you that the impact is probably too much. That's where getting the foundation of strength and proper tissue healing time is important, and where pelvic floor PT can play a big role. Number 3, pressure, bulging, dragging in the vagina prior to or during commencement of running is also a red flag. It could be seen as a sign of pelvic organ prolapse. Doesn't mean you can't ever run, and it isn't dangerous, but it's important to get a good baseline from PT and treat any dysfunction so you can run safely and comfortably. Lastly, musculoskeletal pain is considered a red flag. Running shouldn't hurt, and often musculoskeletal pain can be addressed with a regular strengthening program or physical therapy. Of course, also take into consideration the amount of sleep you're getting, which is most definitely not enough if you have a baby at home. What's your baseline fitness? What's your psychological status? Do you have postpartum depression? Do you have a diastasis recti that could benefit from education and treatment? Are you breastfeeding? Do you know about RED-S, which is relative energy deficiency in sport? These are all things to think about and consider as you transition back into running postpartum. So the 5 things you know when you're getting back into running postpartum are coordination, basic strength training and getting back into exercising, return to impact testing, returning to run, and knowing your red flags. Okay? You can download my free return to run postpartum protocol and return to impact testing on my website, which is mumsontherun.usa.com. If you want more guidance, I offer private coaching for returning to run postpartum, 2 levels of subscription-based run coaching, and if you're in Bend, Oregon, you can see me for physical therapy. I'm Emily Bliss, physical therapist, running coach, and founder of Mums on the Run USA. I'm also a mom of 3. Hit the like button below and subscribe to my channel for all things running and motherhood related. Thank you for watching.